Do you have a bird at home? Has your bird ever had a blood draw? Why would he need it? You're about to find out. I'm Dr. Pat with Little Critters. I've been an exotic vet for 25 years. And this is Rosalie. Rosalie is flighted, so I'm just kind of holding her here because she's a little opinionated and sometimes she goes for a little walkabout, but she loves to have her beak and her head scratched. Rosalie is an 8-month-old conure, very well loved, well cared for bird, and she's just in today for her regular exam, and we're doing baseline or screening labs. So do you know what baseline or screening labs are for? This is important. A lot of people think it's just something a doctor does and it's not important, but it actually lets the doctor know what's going on inside the bird. Birds hide disease, they hide infection until they can't. So knowing what these baseline or regular normal values are in the bird is very important. And so typically when we have a new bird exam, we'll run some labs, take a look at the inside. If everything's normal, we keep that. And then if we have that same bird that develops an illness later on, we can compare and we know what's changed, not for normals for a population, but for this individual bird. And so establishing what's normal for the individual is a very important factor in the doctor being able to care for them and develop and know what the trends are and the changes are that need to be addressed. So what bloods are drawn on a bird and how do we draw blood on a bird? Well, Rosalie's already had her blood drawn and we did record that, so we'll include that in this clip. You can see she's not too angry about it. She did really well. But typically what we're gonna run, our normal kind of bird screen, if we're not looking for a specific infectious disease, is a CBC and a chemistry. So a CBC is a complete blood cell count. This includes all the white blood cells, all the different factors that we look at for red blood cells and for platelets. So it looks for things like anemia, dehydration, inflammation, infection. And then the chemistry is actually an organ panel or metabolic panel. So we see if the organs are normal. Very typically in birds, we'll pick up things like a high uric acid value, which can indicate gout or renal disease or fatty liver disease. We see a lot of changes in birds that they've often been hiding for months, if not years, and so they're important to look for. And then a routine screen that we do with our birds is an electrophoresis. And this is a breakdown of the protein and immunoglobulins. And the reason we do this is because birds get lots of viruses. We don't have vaccines for all those viruses, and we can't test for all those viruses. And instead of doing that, we run an immunoglobulin profile. We look at the different types of immunoglobulins looking for a spike or a rise that indicates they're fighting something. And then we know they're hiding something from us. So those three things are the basics that we do, as well as a fecal and a gram stain.